Okay, well, good morning, everyone. Hello and welcome. Thank you so much for taking the time to join our webinar today. This is a new thing that we're doing here at Vermont OSHA, so you may see more and more in the coming years. But my name is Miriam Owens, and I'm actually the VOSHA's Compliance Assistant Specialist, so I'm the outreach portion of Vermont OSHA. And today we're actually going to spend roughly around 45 to 60 minutes walking through the record-keeping rule, why it exists, who it applies to, and what employers are required to do to comply with it. The session is actually designed to be practical and approachable. It's whether you're a safety personnel, an HR, an office manager, administrator, or a new business owner. My goal today is for you to leave today feeling more confident about what needs to be recorded and what forms are required and what needs to be posted or reported. So if you need this information in an alternate format or have accessibility requests, just please use the contact information on this slide. And if any of your questions come up after today, feel free to reach out, because we're a resource for that. And this one will be accessible for viewing online or not online. Here's what we'll cover today. We're going to start with the purpose and the scope, essentially the why behind the rule and who it applies to. Then we'll look at the record-keeping forms themselves, what makes an injury or illness recordable, and the specific posting and reporting requirements. And then we'll leave time at the end for any questions that you may have. The purpose of the OSHA record-keeping rule is just to require employers to record and in certain situations report work-related fatalities, injuries, and illnesses. Only really important clarification here is what record keeping is not. Record keeping or recording or reporting an injury or illness does not mean that the employer or employee was at fault, that a standard was violated, or that a workers' compensation claim is automatically triggered. OSHA record keeping and workers' compensation are actually separate systems. Good morning. Make sure you mute if you can.
Hey, Sam. Good. So, we haven't received.
I'm not sure who's not
invoice
on mute. Let's see here. Looks like everyone is. Okay. Record keeping is about tracking and prevention, understanding trends so hazards can be identified and addressed, not about blame or enforcement. We're really not here, especially with this presentation, I'm not here about citations or anything like that or enforcement. Just understanding the rule itself. Not every employer is required to keep OSHA injury or illness records, so it's important to understand whether the rule applies to you. Subpart B of the rule explains who the record-keeping requirements apply to and who may be exempt. This is often one of the first questions employers have. Do I have to keep these records? The rule uses both size and industry classification to determine coverage, and even if an employer is exempt from routine record keeping, there are still some reporting requirements that may apply to them. In general, employers with more than 10 employees are covered unless they fall into a partially exempt industry classification. Even if you are exempt from routinely keeping the forms, you are still required to report certain serious incidents such as fatalities, inpatient hospitalizations, amputations, or a loss of eye. And if OSHA or state plan like VOSHA specifically requests your records, you must be able to provide them. Under 1904.1, employers with fewer than 10 employees at all times during the previous calendar year are partially exempt from routinely keeping OSHA injury and illness records. This count is based on the total number of employees in the entire company, not just per location. It also includes temporary employees if you supervise them on a day-to-day basis. However, this is only a partial exemption. It does not remove that obligation to report serious incidents, and it does not apply if OSHA or the Bureau of Labor Statistics specifically request your records. We get questions all the time from schools who say, hey, we received this note saying that we need to record our incidences here at the school. And it came from the Bureau of Labor Statistics. So in that case, even though they normally do not do that, they would still have to do it for that school year. Certain low hazard industries are also partially exempt from routine record keeping, and those industries are listed in Appendix A to Subpart B. Agriculture, construction, manufacturing, transportation, utilities, and wholesale trade are all covered industries, meaning they're not exempt. Many retail and service industries are partially exempt, but it's important to verify using the appendix rather than assuming, because it's based on the NAICS code, which the NAICS code is the North American Industry Classification System code. And it's a 6-digit code used to classify businesses by their industry. It also facilitates standardized data collection and analysis across the United States, Canada, and Mexico. So it helps federal agencies understand the business economy more effectively. The first 2 digits of that code actually represents the business sector, while the remaining digits specify the subsector, industry group, and national industry. Covered employees include those on your payroll and also those who are not on your payroll, but whom you supervise on a day-to-day basis, such as temporary workers. So in those cases, the employer who provides the day-to-day supervision is responsible for recording the injury or illness, not the staffing agency. Excluded individuals include unpaid volunteers, self-employed individuals, partners or sole proprietors, and family members on a family farm. So I actually had a phone call from a volunteer firefighter, and they were injured on the job and hospitalized. In this sense, would that be a reportable when it comes to the regulations? Because this firefighter is a volunteer, it would not be. If a company has multiple establishments, a separate OSHA 300 log is required for each establishment that is expected to be in operation for more than a year. Short-term establishments may be combined, but the key idea is that the record should reflect where those injuries and illnesses are actually occurring, so the trends can be identified locally. All right, so we're going to talk about now, we talked about who was covered. We're going to shift into the heart of the record-keeping rule, which is the forms themselves, and that criteria used to decide what must be recorded. This section is where most questions tend to come up because it's not just about filling out the paperwork, it's about understanding when an injury or an illness actually meets OSHA's definition of recordable. So there are 3 main forms used in the OSHA record-keeping system, and these forms are the same that we use at Vermont OSHA as well. So they're not going to change. We use pretty much the same thing. OSHA 300 log is the running log of all recordable work-related injuries and illnesses. The 301 is the incident report, which captures more detailed information about each specific case. And the OSHA 300A is that annual summary, which is compiled of the total number of cases and types of outcomes. And it's the form that gets posted for employees to see each year. And these forms can be kept electronically or paper as long as all required information is included. And the forms are readable and understandable, and they can be produced when requested. Under 1904-29, employers are required to complete the OSHA 300 log and the OSHA 301 incident report for each recordable case within 7 calendar days of receiving information that a recordable injury or illness occurred. Employers may use equivalent forms, including electronic systems, as long as that information, instruction, and content are the same as the OSHA forms. When I was a safety coordinator for a manufacturing company, we had what they called New Wave, is what it was called, I believe. And in that, it was exactly these 300 forms, and I got to just put in the information electronically, and it computed it itself. It was actually really nice, but those are, I would be considered an equivalent form. The records must be readable, understandable, and accessible to employees and their representatives, and they must meet the accessible requirements outlined in section 1904-35 and 1904-40. Next, we're going to talk about the record-keeping criteria. These are all the different sections that we will be talking about today. So a case is recordable if it meets 3 conditions. It is work-related, it is a new case, and it meets one or more of the general recording criteria or specific criteria outlined in the rule. If any one of those elements is missing, for example, if the case is not work-related or is not new, then it is not recordable. I had a case where an employee was walking to their car at the end of the night. Wind blew some sand in their eye and actually tore their eye. And according to the healthcare professional, that actually was not considered work-related, so I didn't have to record it. An injury or illness is considered work-related if an event or exposure in the work environment caused or contributed to the condition or significantly aggravated a pre-existing condition. OSHA presumes work-relatedness for injury and illness that occur in the work environment unless a specific exemption applies. The work environment can include not just the physical workplace, but also equipment, materials, and other locations where employees are working as a condition of employment. For example, I had an employee injure their knee up camping over the weekend, wasn't work-related. But at work the next day, that employee was getting off of a forklift, and in this case, he jumped off the forklift. They aggravated that knee injury, causing it to become a medical because they had to have knee surgery, which was making that injury work-related and recordable. This slide actually reinforces that work environment. It isn't limited to a single building or a site. It includes any location where employees are present due to their job, as well as the equipment and materials they use. This becomes especially important when evaluating injuries that occur off-site during travel or while working from home. A pre-existing injury or illness is considered significantly aggravated if the workplace event results in outcomes that otherwise would not have occurred. So such as death, a loss of consciousness, days away from work, restricted duty, or medical treatment. And in the case from previously, they had to have knee surgery due to the injury. That was why it turned into that reportable or recordable. If the work environment worsens a condition in one of these ways, it is treated as work-related for record-keeping purposes. OSHA outlines several specific exemptions to work-relatedness. For example, injuries that occur when an employee is present as a member of the general public, symptoms solely due to non-work-related events, or injuries resulting from voluntary participation in a wellness program or recreational activities. They're generally not recordable. Other exemptions include personal grooming, self-medication for non-work-related conditions, commuting accidents in parking lots or access roads, a common cold or a flu. Mental illness is only recordable if the employee voluntarily provides a medical opinion from a qualified healthcare professional, confirming that it is work-related. When employees are traveling for work, injuries and illnesses are work-related if they occur while the employee is engaged in work activities for the benefit of the employer. Once the employer detours for personal reasons, injuries occurring during that time are generally not work-related. OSHA often refers to this as the home away from home guidance. In a sense, I had an employee who was traveling for work. They were coming home. They tripped and broke their toe. That was considered work-related because even travel during a traveling work is considered work, unless they are, again, going off to do personal reasons. But they were just coming home in this sense. So it's something outside the normal of what they would be doing. For employees working from home, injuries are work-related if they occur while performing work for pay and if the injury directly relates to the performance of work, rather than like general home environment. For example, a repetitive strain injury from work duties may be recordable, while a trip and fall unrelated to work tasks generally would not be. If someone were to be talking on the phone for work related and they trip over the family dog, this could be considered, but most likely not, because in that sense, they were doing work on the phone, but they were walking around where they could have just been sitting down in one spot. But if they were carrying work materials and they tripped over a step, that could also be considered. Now that we've established work-relatedness, the next step is determining whether a case is considered a new case under OSHA's definition, which is critical for accurate record keeping. Once we've determined that the case is work-related, the next question is whether it is a new case. The case is considered new if the employee has not previously experienced a recordable injury or illness of the same type affecting the same body, part of the body. It is also considered new if the employee had a prior recordable case, recovered completely, and then a new work-related event or exposure caused the signs or symptoms to reappear. If there is a question about whether an employee had fully recovered from a previous case, OSHA does say that the employer should rely on the opinion of a physician or other licensed healthcare professional. If a work exposure triggers a reoccurrence, such as asthma or a rash, that can be a new case. But if symptoms reoccur naturally without a new workplace exposure, such as with chronic conditions like silicosis or asbestosis, it is not considered a new case. Now we can move on to the general recording criteria. A case becomes recordable if it results in any one of the following: death, days away from work, restricted work activity, transfer to another job, medical treatment beyond first aid, loss of consciousness, or a significant injury or illness diagnosed by a healthcare professional. If any one of these outcomes occurs and the case is work-related and new, it must be reported. Days away cases are those where the employee cannot work for one or more days following the injury or illness. And the day of the injury or illness is not actually counted. You count calendar days, not scheduled work days. So weekends, holidays, and vacation days are included. The total is capped at 180 days. And if a healthcare provider provides an opinion about the number of days away, the employer must follow the opinion. So for example, if the healthcare provider recommends the employee be out for 5 days, but the employee comes back after 2 days, you would still count the full 5 days unless the employee got an updated time frame from that healthcare provider, which they would have to bring in to whomever takes care of the record keeping, and they would update that. Restricted work cases occur when an employee cannot perform one or more routine job functions or cannot work a full day without because of that injury or illness. Routine functions are those the employee regularly performs at least once per week. It could be any task that they do: lifting, twisting, turning, walking, doesn't matter. That's when it comes to restricted work, if they can't regularly perform at least once per week. Job transfer cases occur when the employee is assigned to a different job as a result of the injury or illness. So both restricted work and job transfers are recorded in the same column on the OSHA 300 log. Medical treatment means the management and care of a patient to combat a disease or a disorder. It does not include visits for observation or counseling, diagnostic procedures, or first aid. The distinction between medical treatment and first aid is very important because only medical treatment makes a case recordable. First aid does not. OSHA provides a specific list of what qualifies as first aid. It includes not using non-prescription medication at non-prescription strength, tetanus immunizations, cleaning and covering wounds, using hot and cold therapy, removing splinters with simple means, eye irrigation, finger guards, and drinking fluids for heat stress. If treatment goes beyond this list, it is generally considered medical treatment. Or if they use like non-prescription medication, but at prescription strength. It just depends on where that prescription drug is coming from. So if the doctor prescribed it, it is now medical treatment. So I'll have a question, and either you can raise your hand or use whatever. So my question is, would medical glue be recordable or not recordable? I don't know if they have a thumbs up emoji for, if there's a thumbs up emoji, yes, there's. That would be recordable. If you use, there's only the heart. If you use the heart emoji, that means it's not recordable. If you guys would like to participate in that question. So would medical glue be recordable or not recordable? Okay, I see some thumbs ups. All right, absolutely. So it would be recordable because it has become a medical treatment. Now, another question is, would kinesiology tape be recordable or not recordable? Again, thumbs up is recordable, the heart is not recordable. Perfect. Yes, absolutely. It's not recordable. So the key thing to remember here is non-invasive would be equal first aid, whereas invasive would be medical treatment. Good job. Thanks, guys. Any work-related case involving a loss of consciousness is recordable, even if the employee returns to work the same day and no other treatment is needed. Certain diagnoses are also recordable when work-related, even if they do not result in days away or medical treatment, which includes cancer, chronic irreversible diseases, fractured or cracked bones, and punctured eardrums. Next, we'll look at several special categories, such as bloodborne pathogens, medical removal, hearing loss, and tuberculosis, that have their own specific recording rules. This section will cover the record keeping for bloodborne pathogen exposures. So all work-related needle sticks and cuts from sharp objects that are contaminated with another person's blood or other potentially infectious material must be recorded. Additionally, splashes or other exposures to blood, or OPIM, are recordable if they result in a diagnosis of a bloodborne disease or meet the general recording criteria, such as requiring medical treatment beyond first aid or resulting in days away from work. What does other potentially infectious material mean? The term other potentially infectious material is defined in the OSHA bloodborne pathogen standard at 1910-1030B. These materials include human bodily fluids, tissues, and organs, and other materials infected with the HIV or hepatitis B virus, such as laboratory cultures or tissues from experimental animals. Was talking yesterday in a meeting, and one of the things that was said was, if a vet gets stuck with a needle that was previously used on a cow, is it recordable? And it is not, because of this verbiage, human bodily fluids, blood from a cow is not considered part of that. So that verbiage in the standard does specify human blood. Medical removal cases occur when an employee is removed from exposure under the medical surveillance requirements of a specific OSHA standard, so such as lead or formaldehyde. And these cases must be recorded as either days away from work or restricted work activity, depending on the circumstances. The voluntary removal below the action level of a standard does not need to be recorded. So if they choose to remove themselves from that situation, that is fine, but it is not recordable. A hearing loss case is recordable if there is a change in hearing threshold relative to the baseline audiogram of an average of 10 decibels or more at 2,000, 3,000, and 4,000 hertz in either ear, and the employee's total hearing level is 25 decibels or more above audiometric 0 in the same ear. And both conditions must be met for the case to be recordable. I've actually had recordable hearing loss cases removed because they had a new hearing test done. Maybe they had some circumstances over the weekend causing their hearing to deteriorate or whatever, and then they had another hearing test and it showed as totally fine. So there is that option as well, but you have a limited time frame. We're not going to talk about it here, but there is that option. Tuberculosis is recordable if an employee is exposed at work to someone with active TB and subsequently develops a TB infection. It is not recordable if the exposure occurred outside of work, if the employee lives with someone who has TB, if public health identifies the exposure as non-work related, or if a medical investigation shows the infection actually was caused by exposure away from work. So now that we've covered what must be recorded, we're going to actually look at how records are completed, maintained, protected for privacy, and shared with employees and government representatives. This slide actually shows the OSHA 301, which is the Injury and Illness Incident Report. This form provides detailed information about each recordable case, such as what the employee was doing before the incident, what happened, what the injury or illness was, and what object or substance directly harmed the employee. And it helps employers better understand the circumstances of incidences and identify opportunities for prevention. This form must be completed within 7 calendar days of learning that a recordable injury or illness occurred, and it must be provided to the employee or their representative upon request. And it's also important to fill out everything, especially stuff that has asterisks, to the best of your ability. Not having more information is better than having less information. This slide shows the OSHA Form 300, which it's very blurry, sorry about that, which is the log of work-related injuries and illnesses. And this is where you will record each individual recordable case throughout the year. So each row represents one case. You'll see columns for the employee's name, job title, the date of the injury or illness, where the event occurred, and a brief description of what happened. You'll also classify the outcome by checking the appropriate box, whether it involves days away from work, restricted work, job transfer, or other recordable outcomes. And this form is maintained throughout the year and updated if the status of a case changes. For example, if additional days away occur after the initial entry. And this slide shows the OSHA Form 300A, which is the annual summary. This form is not a log of individual cases. Instead, it summarizes the total number of recordable cases, days away, restricted cases, and other outcomes for the year. And the numbers on this form come directly from the OSHA 300 log. And at the end of the year, a company executive must certify that the summary is accurate and complete. And then it must be posted from February 1st through April 30th in a location where employees can easily see it. OSHA requires employers to protect employee privacy in certain sensitive cases. For privacy concern cases, the employee's name must not be entered on the OSHA 300 log. Instead, the words privacy case are entered, and the employer keeps a separate confidential list linking case numbers to employee names. Privacy concern cases include injuries or illnesses to intimate body parts or the reproductive system, cases resulting from sexual assault, mental illness, HIV infection, hepatitis, tuberculosis, needle stick injuries contaminated with another person's blood, and any other case where the employee voluntarily requests privacy. Employers must inform employees how to report work-related injuries and illnesses and provide a way for them to do so promptly. Employees, former employees, and their representatives have the right to access certain records, including the OSHA 300 log and the OSHA 301 incident report within specific timeframes. If a authoritative representative, so if, say, VOSHA comes in, they are going to ask for your OSHA records. And these need to be provided within 4 business days. But if you're going to do the OSHA form provided by the end of next business day to an employee, former employee, and their personal and authoritative representative. So this is just for personal employee involvement. The OSHA Form 301 can go to employees, former employees, or personal representatives by the end of the next business day, to authorized representatives within 7 calendar days. Provide only information about the case section of the form. Employers must provide requested records to employees or authorized representatives by the end of the next business day, but government representatives must provide copies within 4 business hours during normal business hours of the establishment where the records are kept. So if you get someone coming in from Vermont OSHA, they will want those records, and you have to get them within 4 business hours. OSHA records must be retained for 5 years following the end of the calendar year they cover. During that time, the OSHA 300 log must be updated if the status of a case changes. For example, if days away increase or a restricted case becomes days away case. The 300A summary and 301 forms do not need to be updated. Section 11C of the Act prohibits employers from discriminating against employees for reporting injuries, illnesses, or fatalities, or for exercising any rights under the Act. This protection supports accurate reporting and ensures employees are not discouraged from reporting injuries. VOSHA does incorporate everything in 29 CFR 1904 by reference. So Vermont doesn't have many things that we have separate from Vermont or from OSHA. And this is one of them. We do the exact same thing as what OSHA does. Now let's move into posting and reporting requirements, which are related but distinct from routine record keeping. Posting requirements are separate but close related. Employers must post the OSHA job safety and health poster and any OSHA citations and related documents, and the OSHA 300A annual summary. These postings must be placed where employees can easily see them. So before posting, employers must review the OSHA 300 log for completeness and accuracy and correct any deficiencies prior to having it posted before or during the time that needs to be posted. Then the OSHA 300A summary is completed and it's certified by a company executive, such as the owner, an officer of the corporation, the highest ranking official at the establishment, or their supervisor. The OSHA 300A summary must be posted from February 1st through April 30th of the year following the year covered by the form. So employers must retain the OSHA 300 and 300A forms for 5 years. And a normal place people put it would be like a break room, in a hallway, cork board or whatever. Some people, I think we used to post it not only in the break rooms, but also in front of HR, because people went to HR a lot. The OSHA poster must be displayed in a conspicuous place where all employees can easily see it, ensuring compliance with workplace safety regulations. Key placement guidelines. So the OSHA job safety and health, it's the law poster should be posted in prominent areas within the workplace, such as break rooms, near time clocks, or entrances to locker rooms. It ensures that all employees have access to that information. Must be legible and unobstructed, meaning it should not be hidden behind other materials or in areas that are not frequently accessed by employees. It should be placed where it can be readily seen by all workers. Vermont OSHA also follows these guidelines. For businesses with multiple locations or job sites, each site must have its own OSHA poster displayed in a visible area. This includes temporary work sites and satellite offices. By following these guidelines, employers can ensure that they meet the OSHA requirements and provide essential safety information to their employees. After receiving an OSHA citation, you must post it at or near the location where the violation occurred, ensuring it is visible to all employees for at least 3 working days or until the violation is corrected, whichever is longer. So in the case that we actually got cited with the company I was at before, it was at a pulper, and I not only did I laminate it because it was a wet area, but I did post it on the machine itself, and it was there for, I think it was there for 5 days, because we did the duration of when the violation was corrected, and it took us a little longer than 3 working days. So it just has to be posted for that time frame. So whatever is longer, if the violation is corrected later than 3 business days, then you have to leave it on for that length of time. So now we're going to get into reporting. So when do we call OSHA? When do we call Vermont OSHA? So certain serious incidents must be reported directly to VOSHA, regardless of whether the employer is otherwise exempt for record keeping, which includes work-related fatalities, inpatient hospitalization, amputations, and losses of an eye. When it comes to fatalities, you have to report within 8 hours of that incident. Must report also fatal heart attacks and any work-related fatality. Inpatient hospitalization, amputations, and losses of an eye must be reported within 24 hours. These timeframes apply even if the outcome occurs days after the original incident. Vermont also requires reporting of all mechanical power press injuries within 30 days, as outlined in the standard. Employers should consult the specific standard for what information must be provided. So that's going to be 1910-217G. If the area office is closed, you must use either the 800 number or the reporting application located on VOSHA's website. Establishments with 100 or more employees in designated high hazard industries are required to electronically submit detailed information about each recordable injury and illness entered on their previous calendar years. I believe it's actually now up to 250. OSHA 300 log and the 301 incident report forms are the ones that you will turn in electronically. And this includes data from 300A as well. The OSHA 300A, OSHA 300, and the OSHA 301. The submission must be made annually starting from the beginning of the calendar year and is due by March 2nd of the year, following the calendar year covered by the forms. And the important thing is that reports are timely and complete. So you should be completing your reports within 7 days, so they should be fine. It is recordable, but not reportable if a fatality happens on public transport and the employee is on a work trip. So motor vehicle accidents on public roads outside of construction work zones and commercial transportation accidents involving airplanes, trains, subways, or buses do not need to be reported under this rule. All right, this brings us to the end of the formal content. The record-keeping rule is ultimately about consistency, transparency, and prevention, helping employers identify trends, address hazards, and protect workers. So thank you for your time and attention today. I appreciate you joining, and I'd be happy to answer any questions that you may have. Additionally, safety is always in your hands. That's the primary. But when it comes to our presentations, I'm starting this trend to have some presentations this year. We had obviously the record keeping rule. In May, I am looking to do heat awareness and safety. August, I'm looking to do fall protection, and then December, emergency preparedness. I'm hoping to do the fall protection in person. I'm working on the logistics of that. So if anyone would like to participate in that, let me know. Additionally, I do offer presentations tailored to your workers, which includes leadership and safety, hazard communication, respiratory protection, what to expect when with a VOSHA inspection, or anything else that you are looking for. I do all the research. I compile all the presentation tools and anything like that. So if you ever need a presentation, I know Cody uses my services all the time. It's great. Oh, Richard, I see you have your hand raised. Sorry, I couldn't see the presentation or during the presentation. Go ahead.
No, you just said something. If you ever need a facility for training in, we have a large facility and I will certainly donate the space for that time.
Fantastic. That is great to hear. I like to utilize services that I can, especially if any of your people would like to go to a presentation or anything like that.
No, I'm sure they would. I would open it up. As a matter of fact, we're doing a fall protection training here, I think
nice.
next week.
Fantastic.
But I would be more than happy to host any of these down here we have 2 full training rooms and whatever you would like to do.
Great. That's great to hear. Thank you so much, Richard. I appreciate that.
And is it okay
Mhm.
to share these with members and other people that you're doing these webinars?
Absolutely. Absolutely. And I will be, I know I added you on this one. I'm going to be, when I do them again, I will also add you in on those, and you can forward them to whomever you would like to join or whomever you think would like to join. They're free to the public, and it's just information that I thought would be important for people to understand, especially in the workplace. So, and I know when I was new to record keeping, I was all sorts of confused and had no idea what I was doing. So being able to understand that is great to have that information. So, and again, I did record this, and we will be posting it on the VOSHA website so that people can actually access it afterwards.
Thank you.
Mary?
Absolutely. Yes.
Mary, Miss Kathy Brulette. I also want to let Richard know that, we champion with you at the Vermont Safety and Health Council, and that we also try to advertise your presentations as well.
Yeah, absolutely. I've shared these with as many people as I possibly can, especially the associations that we champion with. So like Vermont Safety and Health Council. So what if an injury is reported by the employee as work-related, but the workers' compensation claim filed is denied as not work-related? When it comes to work-relatedness, workers' compensation and reportable or recordable, they're completely separated. If a healthcare professional states that it is work-related, that is the information that you are going to go off of when it comes to work-relatedness. Workers' compensation is going to be completely separate, and you would have to work with your insurance company to understand why they said it wasn't work-related. Does that answer your question, Peggy? Richard works with AGC. Cody.
1 Grave Street, Montpelier.
Okay, great. Thank you.
And yes, please share with Vermont Health and Safety. That's fantastic. Any other questions? Yes. Go ahead, Xander.
Hi, how you doing?
Good, how are you?
Good. Question about inpatient medical care. And in the municipal realm, this is a really tricky one because in most cases, inpatient care doesn't come to light until well after that 24-hour mark. And so I understand, like, as far as recording is concerned, that the OSHA 300, you retroactively tack it on, you inform, you call you guys up as close as possible. But I think it's important just to note that there is a severe lack of information sharing in real time, especially because it's not as simple, right, as an overnight in the hospital.
Yeah,
So
absolutely.
There's a lot of nuance there, and that information specifically may have a lag longer than 24 hours. So I just was wondering if you had any additional thoughts on that particular unusual asterisk point.
When I was a safety coordinator for a company, this was a question that I had too, because a lot of times I got information well out of that time frame. What I was informed of at that time was when I received that information, I have 24 hours from when I received the information to then go ahead and do that recording or reporting. So say the incident happens midnight at, I don't know, you probably don't do stuff at midnight, but at this facility we had all around the clock. And I didn't hear about it until 9 o'clock the next day, or 9 o'clock the day after the next day. I would then go ahead and report it from that time frame, 24 hours.
Yeah, no, that makes sense. I think the other challenge naturally is just knowledge, to
Absolutely.
understand that, because that does seem like, as far as the education piece is concerned, especially, right? There's this sort of older, or word of mouth, uh, sort of like, well, it wasn't an overnight. Well, it's not just about the overnight, right? And
Yeah.
so that alone, I think, has been an interesting factor to consider. But yeah, I think that's reassuring to know that, once the information that's relevant comes to light, then at that point look at reporting within 24 hours. So thank you for that.
Yeah. And even if like a death occurs, but it happens a month later from that incident, that would be, then you would report it once you hear about the death, even though the incident happened a month prior.
Yeah.
And that has happened to some people, so unfortunately. Any other questions I can help with? Richard, you're on mute. I can't hear you.
Yeah, I'm going to add one thing. only
Yeah.
because you're talking about injuries and whatnot. We have created a great partnership with Vermont Public Health and the Matt Ward and the Stop the Bleed piece.
Mhm.
And we are incorporating, and I would encourage people to reach out to Matt Ward at the Vermont Department of Health. If you want, I'll put his contact information in the thing, but we've incorporated it into our first aid training and some of our OSHA training recently. So I, as well as reporting, let's plan for the inevitable.
Yeah, absolutely. Plan for the worst and be prepared, right?
Yes.
And yes, so this recording, I am more than happy to forward to you. We will also be posting it on the VOSHA website. I'm still kind of new to all of this, so bear with me. I don't know how long it'll take me to get all that taken care of, but yeah, absolutely, Carlin. Yes, Cody.
No, you answered my question. Thank you.
Oh, perfect. All right. Well, I want to thank everyone for coming. I really do appreciate this. This is my first one out of hopefully many, and hopefully next year we'll be doing this as well. Some in person, some not in person, some webinars, and just to kind of go over things that maybe we all had questions for. All right. Thank you so much, guys.
Thank you.
I appreciate it. Have a great day.